I'm Dr. Sorkin from Dr. Sorkin Center for Women's Health, and today I'm going to be talking to you about ovarian cysts. Now, one of the three most common problems that patients come to see me for is lower abdominal pain, and ovarian cysts are often the cause of that abdominal pain. So this is what a normal ovary looks like. It's 2 centimeters by 3 centimeters in younger patients and about 1 centimeter by centimeter in older patients that are menopausal. And this is what a cystic ovary looks like. So there's basically a cyst inside this ovary, which could be either fluid-filled or solid. And it basically swells up the ovary and puts pressure on the capsule of the ovary. And by increasing the pressure, it causes pain, or by rupturing, it causes pain. The way I diagnose the type of cyst that it is and the size is by performing an ultrasound. That's the first line method. If the ultrasound is inconclusive, then I can order a CAT scan or an MRI, although it will take longer to get the result because that is done in a radiology center. So let's look at what a cyst looks like on ultrasound. So this is a transvaginal ultrasonic image of an ovary. It's usually about 2 to 3 centimeters, and it has gray inside, which is the stroma, and then these small cystic structures, which are small follicles. Each one of them houses an egg. Now, when these follicles become abnormally large or irregular in shape, they become pathologic cysts. And this is a good example of that. So here you have an enlarged ovary, more than 2 to 3 centimeters, with different textures inside. And this causes pain by swelling and causing pressure on the capsule or by rupturing. Now, once I diagnose the ovarian cyst, I factor in the patient's age, family history, risk of cancer, what type of symptomatology the patient's having in terms of pelvic pain, and then I formulate a treatment plan. The first option is expectant management, which is basically wait and watch. If it's a small cyst, low risk of cancer, and not causing any major discomfort to the patient, we can just watch it. 90% of these cysts will resolve on their own. Second option is birth control pills. Birth control pills basically relax the ovary and suppress the cysts, and that may take 2 to 3 cycles. And finally, surgery. If we're dealing with a high risk of cancer or very severe pain, then I perform a laparoscopic surgery, which is basically a surgery performed with a camera inside the belly through a small 1 centimeter incision. And basically, I use a special laser to remove the cyst and send the tissue for pathology. So to learn more, go to sorkinmd.com and be aware and take care.